Hey, how funny that she's coming on here right now. Welcome, Erin. Welcome to our second chat with Coach Cass, our second Help Nibble on the weight loss side. I'm here to interview Dr. Nagel. We just returned from a seminar and we're all fired up about what we've learned. Basically, what we brought back is that really what we're doing here is really changing lives. We're helping people reclaim health. The program itself does a fantastic job of helping people burn fat. I've seen people come off of blood pressure medications, come off of cholesterol medications. It really is improving lives. But one thing that we've noticed is when we transition people from phase 1, so there's 4 phases to our program, we transition people from phase 1 to phase 2 of the program is that they're kind of doing themselves a disadvantage. They're giving themselves a disadvantage, and they are ending up sticking with the phase 1 food amounts when they should be transitioning to phase 2 and increasing food amounts as they're going through the program. And I wanted to interview Dr. Nagel about that, just what can happen to the body when you're not increasing those amounts as you're going through the program. So I'm going to turn it over to Dr. Nagel so he can kind of go into a little bit more.
Just turn the camera.
Okay.
Just look at me.
Okay.
Okay, so after seeing Dr. Jason Fung, who is one of the leading researchers in reversing diabetes, we realized, hey, this really needs to be addressed because we know that in the program people get such amazing results, sometimes 50 pounds or even more than that now in 6 weeks. It's really working well for them. But even if it's like 20 pounds or 25 or 30, it's still amazing results. And so they don't want to let that go. And what I want you to really understand is that phase 1 rapid weight loss, it's super healthy, but it's a biohack. And so the body is really smart, and you always have to switch it up. So if you stick with that program if you stick with phase 1 without increasing the food and the fats and all of that stuff, your body's actually going to adapt to that, and it goes into a little bit different mode. It actually thinks it's going to starve, and when you do that, it changes your hormone levels. So what's interesting, Jason Fung presented some of this research, is that when you go on a prolonged low caloric load, and you just try and do that, and most people do that, they like eat the same standard American diet and then they reduce their caloric load, it actually makes your ghrelin, which is your hunger hormone that affects your insulin levels and everything else, it makes it go through the roof. And so, all of a sudden people are starving and they feel crazy about it. And then they feel bad about themselves because they think they don't have any willpower. I don't have any willpower. It has nothing to do with willpower. It has to do with that hormone that's making your brain crazy, thinking you need to eat. So when people in our program stay up, and here's the other point. So it does that, and then it also hormonally makes your body move to this metabolic set point. And that metabolic set point is the weight that so how like you gain weight, say you gain 70 pounds, and then you really don't gain much more weight after that, even when you eat bad, or that's your metabolic set point. It takes a year to reset your metabolic set point. So our program is a year. After 3 months, we kind of release people on their own because they need to do that. But if you go back or then keep trying to reduce that caloric load, it's going to move back to that metabolic set point, which we see when people stop following the program. But the point today is one thing that can make your body want to go back to that metabolic set point even faster is not following the program in the first couple phases. So you think, oh, the phase 1 has done so great for me, I'm just going to stay on phase 1. Huge mistake. We know that. That's why we have the transition phases. So don't take things into your own hands. If you have an idea that you think you're going to outsmart Cass, maybe ask her because she really knows what she's talking about. And that's so don't we just don't want our patients or clients to sabotage themselves. So here's cutting edge information for you. Hope that helps.
I don't know if it's going to flip around or not.
Just stop it.
Okay.